Good day everyone. I am Karthik Reddy and I welcome you all to the training for State Health Department officials. Our first session is on hospital infrastructure, planning and quality management. Today's session will connect you with the national standards with practical strategies to improve hospital services in your respective states. By the end, you will understand how these standards ensure compliance, enhance patients' care, improve operational efficiency and positively impact community health outcomes. Today's session objective, as mentioned earlier, is to introduce you to the Indian standards on hospital infrastructure, planning and quality management. We will follow a structured format as shown here. Hospital planning, we will start with hospital planning standards, going through specific healthcare facility guidelines in which we will discuss on nursing homes, maternity homes and single doctor clinics. Going further, we will start with quality management and performance requirements, performance guidelines in which we will deal with measurable quality benchmarks for hospital services. As we go through the presentation, I request you all to reflect upon your current facilities, where do the standards align with and where might improvements be needed. Going ahead, we will start with our first session on first topic on hospital planning standards. Our objective on this particular topic is to understand structural and functional standards for general hospital planning. The standard IS 12433 is standard for basic requirements for hospital planning, which has been published in two separate parts. First part will cover basic requirements for planning hospitals up to 30 beds and the second part will cover basic requirements for planning hospitals up to 100 beds, which helps in ensuring efficient planning and responsive to community health needs. We will go through different sections of these particular standards. The first standard we will go through is IS 12433 part 1. The first section deals with functional program, the section 2 deals with functional and space requirements, section 3 deals with manpower requirement, section 4 deals with instrument and equipments. And the part 2 of this series deals with building requirements, medical program, functional program, area requirements, workflow and manpower requirements. In hospital classification, we might be seeing there are different categories in our day-to-day life. We use different terms and which are classified into 5 categories, and these categories are given in this particular standard IS 12377. In our day-to-day life, we use this particular classification and you can refer to this standard in having more idea on this classification of categories. This classification is in alphabetical order with code number and the matrix gives you an idea on how these are classified. This standard provides a classification system for different types of hospitals, aims to standardize hospital planning and design, classify hospitals based on size, service and facilities, includes categories like primary, secondary and tertiary care hospitals, offers a matrix structure to help planners determine the requirements of each hospital category, ensures consistency in hospital infrastructure and services, ensures hospitals meet the necessary standards for patient care and safety. The second topic is on specific healthcare facility guidelines. The objective is to explore planning considerations for specific facilities such as nursing homes, maternity homes and single doctor clinics. IS 15784 focuses on healthcare facilities particular requirements, covering requirements from secondary, tertiary level hospitals and specialty and super specialty hospitals. This standard establishes requirements for healthcare facilities to ensure quality and safety, aims to promote transparency and accountability in healthcare services, provides guidelines for the design and construction of healthcare facilities, emphasizes the importance of infection control measures in the design, lists essential medical equipment and instruments required in various departments as well, ensures a balanced staff to patient ratio for efficient hospital functioning, emphasizes the importance of training healthcare workers, promotes the establishment of research facilities within healthcare institutions, provides guidelines for patient care practices to ensure safety and quality, outlines policies for efficient operation of healthcare facilities, also includes guidelines for waste management, infection control and environmental safety. IS 15902 provides guidelines for nursing homes. This standard establishes the requirements for planning and operating nursing homes, covers functional space, manpower, instruments and equipment requirements, defines the necessary departments and services within a nursing home, outlines the necessary medical, nursing and supporting staff, lists essential medical instruments and equipments for various departments, provides guidelines for patient care practices to ensure safety and quality, outlines policies for different operation of nursing homes, encourages regular assessment of and improvement of nursing home services, emphasizes the importance of training and professional development for staff, provides guidelines for record keeping and data management. Next, going on to maternity nursing home, IS 15903 gives guidelines for maternity nursing homes, establishes requirements and planning for maternity nursing homes. This standard covers functional space, manpower, instruments and equipment requirements, defines the necessary departments and services within maternity nursing homes, specifies the minimum area for each department and room, outlines the necessary medical, nursing and support staff, lists essential medical instruments and equipments for various departments, provides guidelines for patient care practices to ensure safety and quality, ensures outlines policies to efficient operation of maternity nursing homes, encourages regular assessment and improvement for maternity care services, emphasizes the importance of training and professional development for staff, provides guidelines for record keeping and data management. Going on to single doctor clinics including dental, IS 15904 gives guidelines for single doctor clinics including dental clinics. This standard specifies minimum norms for planning and management of single doctor and dental clinics, covers different types such as medical, surgical, orthopedic, eye, ENT, dental, OB&G, pediatric, skin, psychiatric, pathology, radiology and physiotherapy. The functional facilities such as reception and waiting lobby with toilets, consultation and examination room depends on the size and load. A special room such as ECG, dressing, minor surgery, audiometry, plaster prep, immunization as needed. Also observation bed for daycare if needed. Going on to the further topic, quality management and performance requirements. This particular area or the topic, we will discuss about quality management principles and the backbone of quality management. Quality management is all about continuous improvement, not just audits or checklists. The IS 15551 quality management system standard of healthcare organizations, healthcare service organizations will help you in improving processes and meet customer needs. This standard focus areas are quality management principles, process approach, continual improvement, error prevention, reduction of variation and waste. Now we will move on to hospital service quality. Indian standard 13808 series part 1 to part 5 defines this particular area. For this series focuses on smaller hospitals with up to 30 beds, covers different areas and with different parts. The part 1 covers outpatient and emergency services. The part 2 covers diagnostics and blood transfusion. Part 3 covers wards, nursing and operation theatres. Part 4 covers hospital support services. Part 5 covers equipment management. Going on to performance guidelines, the objective of this particular topic is to examine performance evaluation criteria for hospital services. IS 15195 and IS 15461 gives you guidelines for 30 and 100 bedded hospitals respectively. These standards specify quality assurance systems, performance requirements, evaluation and monitoring, patient care and safety, operational policies, staffing requirements, training and development, documentation and record keeping. Why does it really matter? Without measurable benchmarks, quality improvement becomes a guesswork. To conclude, today we explored hospital planning standards, facility specific guidelines, quality management systems as well as performance evaluation tools. Remember, standards are not just documents, they are tools to build trust with patients, protect staff and ensure resources are used effectively. As State Department officials, you play a vital role in applying these standards to improve healthcare delivery. Thank you.